All right, welcome everyone for the start and kickoff of our 2025 community webinar series. We'll give everybody a moment to come into the Zoom room here with us. Happy New Year. We're so excited to be back and so excited to have all of you with us. So, this is the launch of our 2025 series. And last year, if you remember, we focused on education or empowerment through education. And so we talked a lot about symptoms and different aspects of well-being to really help you feel empowered to live your best life with Lewy. And this year, we're going to be working on mastering Lewy body dementia together. I'm Julia Wood, the Director of Professional and Community Education here at the Lewy Body Dementia Association. And over this next year, we're going to explore a range of topics monthly to help you better understand Lewy body dementia and its symptoms, strengthen your ability to advocate for services and support. That's what we'll be talking a lot about today. And also pick up some new tools and techniques to help you live optimally. Oh, my slides are not advancing. Let me get that. There we go. So, our mission here at LBDA is to optimize the quality of life for those affected with Lewy body dementia. And in order to do this, we accelerate awareness, advance research for early diagnosis and improved care, and provide comprehensive education and compassionate support. So before we get started, a few technical items. You can select the show captions button at the bottom of on your Zoom toolbar. So for some of you, that might be on the bottom of your screen. If you're on a tablet, sometimes that can be, or like an iPad, that could be on the top of your screen. You can turn that on at any time during the presentation and launch closed captioning. You're also going to notice that there's a resources icon on that same toolbar that has links and downloadable resources. So when you click on that tab, it'll kind of open up on the side, almost like where your chat would be if you had that function, and you can access a lot of different tools there to accompany today's session. You'll notice that we've added a tool here for you. So you can download and print a webinar worksheet. We'll have that available for every session to help you take notes and also develop an action plan to use the information that you learn in these sessions and really take that forward and use it to your benefit in optimizing your care. And so you'll notice too that your chat is disabled, but you can ask questions at any time by submitting those through the Q&A button. We also ask that you please complete the survey that will launch after the webinar so that we can really help improve our content to meet your needs. And then you will receive an email with a link for the recording in about a week that you can share out with friends and family, or in case you get called away today or get distracted, you've always got it there to watch or rewatch at your leisure. All right, so you will notice that we've added a ribbon on our homepage to direct you where you can find the Lewy Learning Center. So if you want to keep learning in between these webinars and these different events that we have, this provides an on-the-go, at your leisure time place where you can access content on a variety of topics. Once again, you can share those out with family and friends and keep educating yourself in the interim. Another resource we'd love for you to know about is our Mediflix channel also. So if you haven't seen the film Spark about Robin Williams and his battle with Lewy body dementia, it's available there for you to watch anytime. And there's also several other videos and resources that you can access. And there's other great channels from other nonprofits and groups and healthcare education for you to enjoy on that channel, all for free. So, also we encourage you to check out our online community and join us there so that you can find out about events and stay attuned of our webinars as we start to post those as we move through the year. Okay, so now I want to thank you for that. Of course, you can always visit our website to register for upcoming webinars and also to find additional content and resources. So now I've told you all about us. I want to learn a little bit more about you all. So um, let's go ahead and launch our first polling question. And we're going to be asking this time bit more specifically about what your relationship is to Louie. So we're asking here, how long have you either been living with LBD? So this could be a care partner or a person with Louie. How long, if you're a or a clinician, maybe you've been treating Lewy body dementia or learning about it. Maybe you're an advocate or a researcher or a healthcare provider. And so we just want to kind of see who's in our audience. We're trying to make sure that we're making our content match up. All right. So I'll give you just a second more on this one because we've got responses still coming in. Thank you all so much for participating. So you'll notice your choices there are 0 to 3 years, 4 to 8 years, 9 to 15, or looks like we've got some seasoned experts here with more than 15 years. All right, it's still responses are coming in, kind of trickling now, but I'll let you keep taking a look at that and responding so we can get an idea of the experience everyone's had, how long you've been living with this. All right, so you'll notice here that we've got the majority of you are pretty new to Louie. So 0 to 3 years here. We've got about 24% of you with 4 to 8 years in, and 9 to 15 years, about 5%. And like I said, some seasoned experts, we've got about 2%. So I'm going to stop sharing that poll now. And so in today's session, we're going to really set the foundation for accessing optimal healthcare by addressing how to build and communicate with your healthcare team. And that leads me to my next question. This will help our presenter a lot, I think. So, how confident are you in your ability to communicate with healthcare providers and advocate for your needs? So, this is really asking our people living with Louie in the audience, our care partners, maybe family members, friends. We just want to kind of see your confidence level because it can be really, really difficult. I think I've mentioned to you guys that I just went through this journey a little bit with my own mother recently and kind of helping her navigate some healthcare issues and found that, she really had a lot of expectations that the doctor would just tell her to do everything. She didn't really understand that sometimes she needed to really advocate and ask those questions, but I was happy to jump in there and help. And I hope you guys all either feel comfortable or have somebody to help you navigate that situation. And that's what we're going to talk about today. All right, so I'm going to end the poll. Looks like we've got most of you in here. So this is good. We're not having anybody come in at that. We got about 1% at that 0 level. So that's good. But you'll notice that most of you seem around 13, 15%, around a 4 or 5. So you're moderately comfortable. And we've got about 11% up at a 7. And then most are at 20% here. So our 8, I had to scroll down to see that. So that's good. Most of you are feeling pretty confident, like you can advocate for what you need. So that helps us a lot. We've got about 9% of you feeling like a rock star there at a 10. All right, so I'm going to stop sharing that and in that poll. And now I really want to give a warm welcome. So I'd like for you to use your reaction button when she comes in here to meet our presenter. So Sarah Mitchell Chen is a licensed clinical social worker at LBDA's Research Center of Excellence at Rush University Medical Center. She has more than 15 years of experience working as a clinician, a program coordinator, and research team member with the Persevere study. Sarah has spent her career providing care management in long-term care and ambulatory healthcare settings where she works to address non-medical barriers to wellness and improve health outcomes for patients and care partners, focusing specifically on individuals and families impacted by symptoms of various neurodegenerative disorders and forms of dementia. Interdisciplinary movement disorder supportive care clinic at Rush. Sarah has completed advanced training and certification in palliative care with an emphasis on helping patients and care partners better understand their choices and preferences for medical care and non-medical care. So you guys have been giving your love and your applause there. Thanks so much for welcoming Sarah. Thank you for joining us. Again, Sarah was actually here back in 2023 as part of our palliative care webinars. We're so glad to have you again, Sarah. Oh, and you're on mute. We'll let you turn your microphone on. No problem. Take a second and get comfortable.
All right. Am I unmuted?
You're unmuted. That's excellent.
Perfect. Okay. Thank you so much for having me. I'm really thrilled to be asked back again to talk about building our care team. So we'll get started. We're going to talk about, and the poll was really helpful because it's going to allow me to tailor a little bit about what we talk about today. But we're going to talk about how you build a care team, how you effectively communicate with that team, and navigate any potential challenges that may come up. So when we think about building our care team, it's important to surround yourself with a variety of different professionals and team members, because everybody brings a little bit different experience and different training and looks at a situation or a concern differently. And we want that broad spectrum, that breadth of knowledge as we're approaching a concern or a symptom, or just thinking about how we navigate through Lewy body dementia. And we may think about over time, some of those team members may shift. Someone that was really involved early on may step back a little bit as we make space for a new team member to kind of step up and fill and address some new or changing concerns. And often we think about, how do we find care team members? We'll talk about, I'll touch on this as we go through the slides, but what can be really helpful is asking your providers, asking your specialists, asking your physical therapist, asking the people that you're seeing. They know who's available in your community. They may not know everyone, but the more people you ask, the more likely you are to find people who are equipped and trained to work in the neuro space and have some of that background. And then asking your people in your support groups. They are a fantastic resource. I can't tell you how much I learn from members of the support groups that I facilitate. Honestly, I learn more from them each month, and I'm feel like a fly on the wall getting to soak it in. So lean on those resources. When we think about who might be part of your care team, first of all, you're the center. You as the individual living with Lewy body dementia, you as a care partner supporting and loving someone with Lewy body dementia. And then we're thinking about the providers, the various providers who care for the symptoms that might be going on, the rehabilitation teams that might step in pending kind of what symptoms we're addressing, and then how we address well-being, emotional well-being, spiritual well-being. So as we break it down to kind of, sometimes people ask, like, who do we go to for these particular symptoms? And that's a really valid question, and sometimes confusing to kind of sift through, because there can be quite a bit of overlap. So you might think about, for your motor and non-motor symptoms, for LBD, which we all know that I'm going to say this so many times, everybody's experience with LBD is a little bit different. So you may notice that you don't really have motor or non-motor symptoms. So this might not be a big concern for you. But should you have these symptoms, a neurologist or movement disorders doctor may be the one that helps you address some of these concerns. If you're have maybe more neuropsychiatric concerns, some of the hallucinations or delusions that can come along with Lewy body dementia, or you're noticing cognitive changes, you might be leaning on the psychiatrist or the cognitive neurologist. And then depending on what other things may be going on, I guess I want to take a step back. Don't be alarmed by all of the different providers on this list. Your team you may not need all of these people, or there might be people that I left off this list that are a part of your team. So this is just kind of a sampling of who might be involved. But if there's other autonomic symptoms, blood pressure, frequency with urination, or up all night, having to go to the bathroom, a urologist might be involved. If you're having issues with digestion and constipation, you might have a gastroenterologist involved. Or visual changes, maybe neuro-ophthalmology. If you're losing weight or having trouble keeping with the weight on, we might involve a dietitian. So all of these people, I hope you're kind of catching the drift. All of these people have their own background in training and lend something to your team. And then our rehabilitation teams are critical. So continuing to work with physical therapy, finding therapists who have a experience or knowledge in neuro training. And we may find these people through an academic medical center. They tend to have providers who are more familiar with neurologic conditions or neurodegenerative diseases. But there are also certifications that therapists can gain, one being through LSVT, big or loud, Parkinson's Voice Project. There's several programs like that that therapists can participate in and get certification. And that is an indication to you, or can be an indication to you, that they have interest and experience in treating people with neurologic conditions. And so those are also valuable resources to consider. And if you call the therapy center in the strip mall next to the grocery store, because it looked like you went on one of those lists and they had a physical therapist that was trained, and you call and say, hey, is Joe available? I want to schedule an appointment. And they're like, oh, Joe doesn't work here anymore, but we can set you up with Sally. She has some experience. You can say thanks, but no thanks, because you really want to make sure you're seeing a therapist. If you're going to make the effort to get there, you want to make sure that you're seeing someone who's equipped and trained to be able to support your needs. So that goes for all of the rehab providers. And then when we think about emotional support, in addition to those family, friends, neighbors who are so critical, maybe we think about a chaplain or someone from your faith community, maybe a psychologist or a therapist, perhaps social work, if you're trying to navigate systems, understand what resources might be available. So all of these people together contribute to your overall care and well-being. So as we think about then how we effectively communicate with our teams, our appointments, how we prep for some of them, we really want to think about self-advocacy. And so when we speak up for ourselves, we're advocating for what our needs are. You're representing you or your loved one's needs and concerns to their healthcare team. The healthcare team doesn't know what's going on unless you tell them. They may have suspicions. They may have a list of symptoms that they're going to review at the appointment, but that is a broad list of symptoms that they're going to review with all of their patients. But you may have some very specific concerns. Some new things may have come up, and your care team is only going to know that if you're able to share that with them. And that's going to maximize the time you have in that visit, and you're going to feel like you're both engaged and empowered in your care. You're the expert in your Lewy body experience. You know what symptoms are new, you know what symptoms are changing, what's been the same. And so making sure that if you're seeing a newer provider, that you're articulating that to them too, so they're not getting hung up or going down a rabbit hole that we've been down before. And really, this other concern is the thing I really want to focus on today. And I just want to validate, it can feel really frustrating to have to retell your story over and over and over again. And I don't know that there's quite any way around that. It will be in your medical record if you're being seen at certain healthcare settings that multiple providers are a part of, but they may read that and it may not connect for them about what that really means for you day to day. So speaking up, maybe it's figuring out kind of a phrase or a short, brief description overview of what Lewy body looks like for you, so that you have that to pull out when you need it. But it is frustrating to have to retell your story. And because you are the expert, because Lewy body isn't as well known, and even if it is known, your experience is so different that it's important to continue to speak up for yourself and tell those around you what you need. And then the healthcare setting can be really confusing to navigate. It is a giant beast and there are lots of moving parts. And so you may also have to use some persistence as you're trying to move through to get a test scheduled, to find a provider, to get the results, make sure you're getting a refill. It might take a little bit of persistence. And some of the ways that we kind of approach the communication strategies that we use can be really helpful. You catch a little bit more honey or bees with honey rather than vinegar. I messed that up all, but you get my drift. That the trying to be as patient with the people on the other end of the phone when you're calling can go a long way in getting you a little bit further as you're trying to sort things out. So as we think about communication strategies, we really want to try to have open communication both ways, but thinking about how we clearly communicate what is going on. So how each of the care team members are communicating with one another so that everybody is informed and on the same page and working towards the same goal, that we're making decisions together, and these decisions reflect what your wishes and preferences are, that they align with your needs. We want to utilize active listening. So I don't know if you've ever found yourself in a conversation where you know exactly what you want to say next, and even though the other person is still talking. And so we may have missed all of the other things that were said, or may not have fully been able to hear that because we're so focused on formulating what we're going to say next. Active listening is a process where we try to be really present and listening in the moment so that we can be responsive to what's being said. And it can be a way to engage providers and help them understand both what is going on for you, but also try to help them understand where they're coming from so that you can ask good questions that lead you to getting more information, lead you to getting what you're hoping to find out, or clarifying questions or concerns you might have. And we're really doing this in the service of trying to make collaborative decisions. So, we really want you to take away from this presentation that you are an engaged member of your healthcare team. You're at the center, but it's not just happening around you, that you're participating in it and that you're participating along the way. Collaborative decision-making really empowers you to be more active in your healthcare. And it, also can increase your engagement. Someone recommends a test and you're like, oh, I don't want to go get more blood work. I just got blood work 2 weeks ago at my primary care doctor. Why does the psychiatrist want me to go get blood work? If you're able to have a discussion, come up with a treatment plan more collaboratively. Here's our concern. Here's our treatment options. Okay, they've talked about the risks and benefits for each one, and you decide together, okay, this is what I would like to try to do. Then, all right, I understand I have to go get blood work. I'm not thrilled about going to get the blood work, but I understand why, and it's my choice that's the treatment plan that I'm choosing. So it can really help with your engagement and your participation, and also engaging your providers as well. So when we think about preparing for our appointments, how to get the most out of them, appointments can be fast. They can be overwhelming. You can think about the things you want to talk about, and then you can get to the appointment and sit down and your mind is blank and none of the things you thought about are there anymore. So a little bit of preparation can be really helpful, especially writing it down. So make a list, all the symptoms, what are your concerns? And then we need to be realistic. You're not going to have time to address 12 concerns in your visit today. What are your top concerns? How do we prioritize the top 2 to 3? And that's what we want to focus on. And then what are your questions? How do as they relate to those 2 or 3 concerns, what questions do you have about those? And try to kind of group things together. So we're talking about, new symptoms, Think about what's happened since you saw that provider last. Have there been any changes? Were you hospitalized? Was there a fall or a near fall? Did we almost fall like 6 times? But we never fell. So if the doctor asks us if we fell, we say no. But something's going on with our balance because we didn't used to almost fall. So thinking about near falls, hospitalizations, new medications, planned surgery, urgent care visits, things like that. Really helpful to kind of jot down so that also you think back, what's happened since I saw the provider last? You also want to think about, are there any new medications, any concerns about your medications or new side effects that you've noticed? You might not be sure if it's a side effect, but you've noticed you started a new medication at the last visit, and then you noticed something was happening. Maybe you got a dry mouth, or you started to have itchy skin, or who knows? All those medications can have a side effect. If you're starting to look back and think about that, you can bring that to the visit and say, is it possible that, my new dry mouth is kind of related as a side effect to that medication? Are there any ideas or strategies that I could, use to help address that dry mouth? And then you think about too, having a conversation with your family. Who else is going to go with you to that appointment? It can be really helpful to have a support person there, another set of ears, someone else to write things down, ask follow-up questions, but go into those appointments on the same page. Have a conversation ahead of time. Here are the concerns I think are important. Do you have any things that I'm missing? Okay, these are still our top 3 concerns. We're really going to try to focus on these concerns. And then, if care partners are going with a loved one, and as a care partner, you're noticing a new symptom and you may want to have a conversation with your loved one ahead of the visit to say something like, I think it's really important that we share with the doctor that you've been occasionally seeing some animals in the house in the corner that we know aren't there, but that's new. And it gives you and your loved one an opportunity to be on the same page. Your loved one with Lewy Body Dementia may not like the fact that we're going to be telling the doctor about this new symptom. But if we can try to have that conversation ahead of time so that everybody knows what to expect in the visit, that will make things go more smoothly. And you as a care partner may feel more free to be honest and share what's going on. So additionally, some of these may feel kind of basic, but thinking about getting the most out of your appointment, try to arrive on time. And I know that this can be particularly challenging when we have a neurodegenerative condition. So thinking about, planning extra time into our day, knowing that things are probably going to take us longer. Bring your medication with you. You may be gone longer than you're expecting. The visit may be running late. There may be something else they want you to do, or there just may be traffic. Bring the doses of medication that are scheduled while you're at the doctor's office. You take your medication. Unless they've told you not to take your medicine for whatever reason, bring all the medicines for that afternoon, and bring your 3 o'clock dose and your 6 o'clock dose if there is one. Better safe than sorry. Bring those with you, and bring a snack too. I didn't put that on the list, but sometimes it can be helpful to make sure you bring water and a snack, especially if things are running late. You want to stay focused on those prioritized concerns. It can get really easy. It can be really easy to get off track and kind of lose focus of what those concerns were. So really try as best as you can to stay focused during the visit on those top 3 concerns. You can even share that at the beginning of the visit. When you're roomed and the medical assistant says, what's changed since you were here last time? You can say, I have a few concerns I really want to make sure I speak to the doctor about. Here are my concerns. And then when the doctor comes in and asks how you're doing, you can say, while we're here today, I really would like to make sure we address X, Y, and Z. And then ask clarifying questions and be honest and upfront about your concerns. So if the doctor is recommending a new medication or recommending a change to the schedule and you're not so sure about it, you know, express that to the doctor. I'm concerned about adding a new medication. I'm concerned about pulling back on that medication. How is that going to affect X, Y, and Z? That way you can have more information, and it may help, again, empower your choice about whether you want to follow that treatment recommendation or whether it's something that you say, you know what, I'm not comfortable with that. Are there any alternative options? And then take notes. A lot can be discussed during that visit, in the same way that when you sit down, all of that preparation might fly out of your head. If you don't write it down, you can walk out of that visit feeling a little bit overwhelmed and have a difficult time remembering what was discussed. And then, like I mentioned earlier, consider bringing a support person. So here are some ideas or strategies to stay focused, to make sure that we're addressing those concerns. You know, I'd like to make sure that we address X, Y, and Z. The provider may say, you know, I want to make sure we get a physical exam today, or I want to check a couple things. Great, I understand. And I also want to make sure we address X, Y, and Z. If you're wrapping up and they, you know, you want to make sure that we come back to before we wrap up today, I want to make sure we come back to my question about blah, 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 or I'm concerned about this new symptom. I want to make sure can we come back to it because I have a few more questions. You know, what can we do about it, or what are my options? It's very reasonable to help redirect the conversation kind of back to those concerns. The challenge can be if we have 7 concerns and we're kind of all over the place, we're really may not be able to actually leave feeling like we got anything accomplished. It can feel so scattered that we don't feel like we have a plan or next steps. So when we can kind of try to focus on your concerns and help make sure that we're coming back to those concerns, you can get to a better plan going forward. And that's where you can ask for, if there's a recommendation to change your medication, can you please write out the schedule for me for the next 4 weeks? Write it down for me in the notes that you put in that I'm going to get when I leave. Or, you know, they're recommending, you have a new symptom and they're recommending you go see someone. So they say, go see a urologist. Okay. Can you recommend the name of a urologist that you would recommend I see based on my neurodegenerative disease? Who do you know that's familiar with this? And ask them for, you know, any recommendations. If you were to go to the urologist, is there anything that I should avoid? You know, can you write that down? If they recommend that I start a medicine, are there certain things that I should not take given my neurodegenerative disease? You can do some of that up front, so that then if you get to the urologist that was recommended, you can take the handout that your provider left you with the medications that are to avoid, and you can say, hi, your new urologist, my provider recommended I see you. If perhaps you want to start a new medication, my doctor said I should avoid X, Y, and Z. Then you may be able to walk out of that appointment with a plan and next steps as well, instead of a urologist saying, okay, well, I'm going to need to check with your doctor before I start anything because I'm not sure what it's safe for you to take. So starting to think about some of those things as well. What happens if we need to go to the emergency room or be hospitalized? Some of these things may be a little obvious, but, you know, making sure that we have a current list of medications. Things are getting changed frequently, and if you're seeing providers through multiple systems or in the community and an academic medical center, everyone may not always have the updates. The healthcare system uses the electronic medical record, but not all of those medical records communicate smoothly and seamlessly so that all the information is always up to date. So keeping a list of the medication, the doses, when you're taking it with you, so that if you go to the hospital, you can say, here's the accurate list of my medication. Can we check it against what you have in your system? That reduces errors. It makes sure that you're feeling as well as you can feel despite the circumstances, because you're getting the medication that is recommended. You also want to think about making a list of any other pertinent medical information. having any advanced directives, copies of them. Again, they might be on file with one medical system, and the other medical system that's closer to your house or vice versa may not have them. So kind of keeping a packet of some of this information or storing it electronically so that you can access it in your email or on your phone can also be a helpful resource. And then making sure, keeping a hospital grab and go bag. In the event of that for whatever reason you need to be going to the emergency room, having a bag with a change of clothes, a phone charger, the list of all of these pertinent information so that you can just kind of grab that and go, and it's all put together, can also be really helpful and make things a little bit more comfortable in the midst of what can often feel like very stressful situations. And then thinking about during a hospitalization, how do you advocate, or how does family advocate for you as someone living with Lewy body dementia? Speak up. That's the first and the last and all the things I'll say. Speak up. The staff on the floors may or may not be as familiar with Lewy body dementia, even if you're working at an academic medical center. If you're admitted on the cardiology unit, their nurses may not be as familiar with Lewy body dementia as maybe the nurses on the neurology unit. So it, also depends on kind of where you're admitted within the hospital. So sharing what you need with your Lewy body dementia. It's really important that I get my medications on time. Here's why. My symptoms can get worse. If I don't get my medication, I won't be able to participate in physical therapy because I'll have more difficulty with slowness and stiffness. Or I'm going to have difficulty feeding myself, kind of helping the staff, trying to be as calm and patient as you can. Again, it's really frustrating to retell your story over and over, but we're really trying to be collaborative, to have everybody on the same team. And we can do that by trying to help them understand, to help educate them about what's going on and why this is so important. It can be helpful to have a family member with your loved one during an admission, or with you during an admission. This isn't always feasible. I recognize that. It can be a lot when your loved one is admitted to the hospital. Having someone there can be really helpful to just kind of continue to keep an eye on what's going on. If there's any changes with the medication or suggestions of a new medication, making sure that if someone wants to start something new, you can say, wait, I would really prefer that you reach out to my loved one's neurologist to run this by them before we start any new medications. So that can be really helpful too. If you're concerned that they haven't reached out to the treating neurologist, you can also request a neurology consult in the hospital so that the neurology team will come in and see your loved one. That's not necessarily automatic. So usually they have to consult neurology to have them come. The same thing goes for if you or your loved one is hospitalized. Your provider may or may not be notified automatically. So you may want to reach out to the office and let them know that your loved one was hospitalized. The other challenge is your community or treating neurologist can't call the hospital and ask to speak with the treating doctor. Usually it has to go the other direction, that the treating doctor at the hospital will reach out to your community provider. So that just knowing that as well can be both annoying and helpful to kind of understand how the system works so that you can advocate through the system and help get everybody communicating, making sure that we're on the right medication, that nothing is stopped or missed, or we're not getting put on a medication that maybe isn't in our best interest. And then a really helpful one is there are certain medications for people with Lewy body dementia that really it's recommended that they avoid. And so one key way to try to help make sure your loved one doesn't inadvertently receive these medications is to ask the hospital to list them as an allergy. And so that will flag a bunch of people. If a doctor, for whatever reason, tries to order one of those medicines that are on your allergy list, the pharmacist will get flagged. Like, it kind of enables some extra checks and balances. And that can be really helpful too. So just some kind of, and those can be put in at the hospital during the admitting process. They can also be entered in the community, in your doctor's office, trying to make sure that they're listed in every system as allergies can also be helpful to just make sure that they're there as an added protection. And then if we're thinking about having a planned surgery, or even we've been hospitalized for whatever reason, and they're thinking about having surgery, there can also be some advocacy, self-advocacy that goes along with a planned surgery. So wanting to make sure that that the surgeon or whoever is recommending this procedure is aware of Lewy body dementia. Also wanting to make sure that the neurologist or whoever you're seeing for routine care, you can check in with them and say, what are your thoughts about this procedure that's been recommended? Is it something that makes sense for me? And then if everybody's on the same page and says, yes, we think that the benefits of this outweigh the risks, then recommending, asking the neurologist if they can speak with a surgeon or the anesthesiologist if there are any medications that we should avoid. Again, we want to think about preventing as much, or just not exposing people with Lewy body dementia to medications they can be particularly sensitive to. And so that can take a little bit of pre-work ahead of time to try to avoid some of those accidents. And then, speak with the provider about what to expect for recovery. Your surgeon may say, for a typical patient your age, I would expect that you'll be in and out and going home the same day. And then you may talk to the neurologist, and the neurologist may say, well, given your sensitivity and how sometimes it can take a little bit longer to kind of recover from things, you might be able to go home the same day. There's also the possibility that you may be held overnight. So just kind of getting a sense of what to expect so you can manage those expectations, and also understand that, like, if for whatever reason you do need to stay overnight, that you're not panicking to say, oh my goodness, something went wrong, what went wrong, that this is more of a known possibility, can also help ease some of the uncertainty around a potential procedure. And if there is a potential procedure, again, that grab and go bag or packing an overnight bag can be helpful, again, for both you as a care partner and for your loved one with Lewy body dementia. There are a few things that might make a potential unplanned overnight stay in the hospital a little bit more comfortable. And so, better safe than sorry. The worst thing is that you get to go home that same day and you're unpacking, that bag, but you knew that you were going to have a change of clothes for tomorrow. So that can be really helpful. The other question we often get is, how do I know if a procedure is necessary? And I can't answer that for you. I'm a social worker, but what we can think about is, sometimes the benefits and the risks of a procedure may change over time, and that calculus, or kind of how the doctors decide what do we need to do, may shift. And so having some of those conversations can be really helpful too. If you're experiencing severe constipation and the gastroenterologist is recommending a colonoscopy, well, they may decide that that makes a lot of sense because there's a symptom that we're trying to better understand what could be contributing. But if you're not having any constipation, it's, a routine colonoscopy, and you're 85, maybe the neurologist might say, I don't know that we really need to do the colonoscopy at this point. Now, I'm not weighing in about whether or not you personally, individually, should have a colonoscopy or not. I'm more suggesting that is an example of some of the calculus that can be involved, and why it can be so important to talk to your providers that are involved. Because you may feel like, I don't know if I want to do this. I'm not sure I feel comfortable with this, or this doesn't feel as urgent or as important to me to address. And the surgeon may say, no, I think this is very urgent. We really do need to address this. And the neurologist may agree. Or you may all kind of be like on the fence, I don't know that it's something that we really need to address. We can keep an eye on it and monitor and reevaluate in 6 months or a year, or, kind of keep that treatment plan that way. If you're having trouble or you're not sure kind of how to think through some of these things, a palliative care provider can also be really helpful to make sure that both you understand what your wishes and preferences are, and then help you align the treatment decisions to match with those wishes and preferences. So again, another specialist. I understand that it would be one more appointment in a very busy schedule, but sometimes that can be a really helpful input, a more holistic approach, and helping you think through some of these things. And then how do we navigate some of the challenges? You are likely to expect some challenges, and you may need help kind of to help educate your healthcare team. It can be such a headache to re-educate people about what LBD is and remind people, no, I can't take this medicine because I have Lewy body. I'm very sensitive to medicine. Or no, I do need to go see a maybe it's talking to the insurance company. I need to see this specialist. I know they're out of my network. I'd like to appeal that decision because this particular specialist has this particular training and background and expertise, and that's what I need. And those can be really frustrating things to run up against. Being patient, because you may have to remind both your care team members, you may have to continue to follow up to make sure that you're getting the results from your test or your new prescription. But that can be something that can be really frustrating, but can also be it's a collaborative process. So trying to figure out how you can align with the providers or the healthcare health insurance company, or where do we align, and then how can we join into that process, and where can we move towards getting on the same page for these other things? Is there a nurse that your neurologist particularly works close with? Is that the person you should be calling to ask for when you call the office with a question? Instead of going through the main call center and just getting sent to the nursing pool, maybe you should be specifically asking for the nurse that works with your provider and say, I'd really like a call back from Sally. And that may help you kind of move through the process a little bit more easily. What if you're, concerned about how a hospitalization is going? You're not feeling like you're being heard. You're not feeling like the staff is being responsive. You're doing your best to be patient, to re-educate, to be collaborative, and you're feeling like you're not getting very far. You may want to ask to speak with a nursing supervisor or a social worker on the floor to talk about your concerns, or your concerns for your loved one, and see, what ideas or strategies do they have? Are there ways that they could potentially intervene or advocate on your loved one's behalf? You might consider speaking with an ombudsman in particular parts of the country, or for many academic centers, they might be or hospitals, there may be a patient relations department. If you have concerns, again, you're not feeling heard, or you feel like your concerns aren't being taken seriously, patient relations can be another resource. And then, you might consider, if your loved one is hospitalized, you might consider a transfer to another institution. And that is also a process, and it is dependent on availability at the other institution that has a little bit more expertise potentially in caring for people with Lewy body dementia. But those are some strategies that you might consider if you run into some bumps along the way. And then the other thing you might wonder about is, do I need a second opinion? How do I know if my current provider knows what we're dealing with here? Or how do I feel confident that they're addressing my concerns? Some things that you might think about are you having new symptoms, or your symptoms are changing, or they're getting worse, and your provider is really trying what they know to do, but it doesn't seem to be helping, or, heaven forbid, your symptoms are getting worse. They've tried something and you're noticing, in spite of that attempt, actually, I'm feeling worse than before we tried that. Maybe it's time to think about, finding a different provider. A vast majority of providers or patients with Lewy body dementia are being treated by a primary care doctor or maybe a general neurologist. And for many people, that can be okay for a period of time. And then we might reach a point where we need the input of maybe someone with a little bit more expertise or specialization. And so that's where maybe thinking about the list of providers that I offered at the beginning, where you might consider going and seeing a movement disorders doctor or a cognitive neurologist or a psychiatrist that's more familiar with Lewy body dementia, who might then be able to bring their expertise to help try to address the symptom or concern that you've been having trouble kind of getting at. You also might feel like if your concerns you're not feeling like you're being heard or taken seriously, or that maybe it's not a good fit, that you've taken some of these strategies to heart, you've made a list, you've prioritized, you've tried to go in and stay focused, redirect the conversation back to your concerns, and you feel you're not being heard, that the doctor has another agenda or is really rushing and not attuned to your concerns. That might be another clue or time to think about getting a second opinion. And I want to acknowledge that access to care is a big challenge. In vast parts of the country, you may not have access to multiple neurologists that you could go to see, or multiple a movement disorders doctor or a cognitive neurologist. And so one thing that you can think about is the potential for video visits. Is telehealth an option for you where you are? It might mean, and some of those rules you'll have to double check. For many, telehealth is available within the state that your provider is licensed in. So here in Illinois, where I am, we're very close to the Illinois-Indiana border, but telehealth is not available. We're not able to cross state lines. And that's an institutional rule that the institution I have works at, but it's also aligns with federal rules as well. So thinking about telehealth as an option, but finding a telehealth provider potentially within the state where you reside, and looking at, oftentimes for you to be established as a new patient, perhaps the provider will need to see you once in person. Is it feasible to get there one time for an appointment? The answer may be no. It may not be feasible. And that's really frustrating. I wish that care was more easily accessible. But if it is feasible to maybe do a one-time appointment to establish care, could you then do follow-up appointments by telehealth and get access to providers that you may not otherwise be able to see regularly? So that's something to think about. Another caveat to that is a note about telehealth. So telehealth was expanded during the pandemic era, and those benefits are kind of tied to the federal spending bill. And so they were set to actually expire at the end of 2024, but the they extended the spending bill, so the government is funded through the end of March. And so telehealth services have also been extended through the end of March of 2025. But if they don't renew them, we'll lose access to telehealth benefits. And for many folks, that this can be a really valuable benefit. It allows them to access services that they wouldn't otherwise have access to. So the American Academy of Neurology has this nice option on their website that you can go to, fill it out. You can identify as a patient advocate. I've completed this. I'm not a neurologist, but it will look up by your by your zip code to figure out who your representative and senator are, and they'll send this to them. The more that they hear from people in the community around the country to say telehealth is really important to us, we want you to continue to extend that, the more likely that they'll continue to extend this service and allow people to continue to access services and reduce, not eliminate, but reduce barriers to being able to find care that they need. So, as we begin to wrap up, thinking about how you utilize the various disciplines to help you and your loved one as you move through this Lewy body journey, and leaning on their specific background and training, how to be proactive for the appointments or hospitalization or potential surgery, and then thinking about how you can resolve challenges or move through those challenges and utilize some different communication strategies. The other thing that I do want to mention that you may have heard about from Lewy Body Dementia Association is the Persevere study. I'm a part of this study out of Rush, and it's a national study for Lewy body dementia care partners that's looking at an educational intervention specifically designed for care partners, because we know that there's such a demand and a need in the community. And there are resources and support, but it's not enough. That support groups are really valuable, but it doesn't, help address all of the education or connection needs that people are looking for. So the Persevere study, I'll let us play this little video clip. So Persevere is a study specifically designed by and for care partners whose loved ones have Lewy body dementia or dementia with Lewy body or Parkinson's disease dementia, or care partners whose loved ones have cognitive changes or hallucinations, but may not have a formal diagnosis. It's a 12-week virtual intervention for people across the 50 states and US territories. So you could be anywhere within the US. To participate, you need to have access to a working phone and the internet. And then we're continuing to enroll participants. We're enrolling care partners across the country we're trying to reach caregivers who are earlier on in their caregiving journey with a loved one with Lewy body dementia, or kind of on their road to being diagnosed with Lewy body dementia. We know that it's really difficult to find credible resources and information, and this is trying to help fill that gap. So if this is something that you're interested in, you can follow the QR code or the link here. And I know that the flyer is also included in the resource page, or reach out to us if you have any questions. But continuing to help spread the word. And we want to thank Lewy Body Dementia Association for being a partner with us on this study. So with that, I'll turn it back over to Julia and open it up to Q&A.
Excellent. Thank you so much, Sarah, for that incredible presentation. That was really, really helpful. And we've got some great questions queued up. So we'll get going with those. And they're giving you lots of kudos there. Thank you so much, you guys, for those reactions. That's fantastic. Great job, Sarah. All right, so let's get started here. So I think this is a great question to start with. How do you even know what types of care professionals you need and how they help? So she's thinking, versus just primary care and a neurologist, kind of how do you decide who you need to see?
That's a great question. Um, I think that it can be a challenge to kind of sort through as that. I tried to lay it out, but I was even struggling to figure out who do I put where and who helps with what. Um, I think it's starting to think about, are your needs being met where you're with the people that your loved one or that you are currently seeing? And if there are particular symptoms or things that you're feeling aren't being fully addressed, what are those symptoms? If it's cognitive, then maybe we need to loop in someone who is more specialized with supporting cognitive changes or psychiatric changes, or you're seeing a cognitive neurologist because cognitive was the concern you noticed first, but now we're starting to notice that we're having a little more difficulty with our walking and our balance and tremor. Maybe we need to be seeing a movement disorders neurologist. So I think some of that is going to be dependent on sort of who you're currently seeing and how your needs are being addressed and what are the unmet needs, and then where do we, how do we fill in some of those unmet needs? I don't have
Absolutely.
a great answer. Everybody's a little bit different because it's hard. It's hard to figure out where we're getting care and what we have access to. We may not have access to all of those care providers where we are around the country as well. It's a very
Oh, for
real
sure.
possibility.
Oh, for sure. Absolutely. I think that's becoming more and more difficult for sure. Um, Here's a really great question that I think comes up a lot, right? Um, so how this individual is a caregiver, right? And she, a lot of times there's maybe some issues coming up that the caregiver wants to bring up, but maybe the person with LBD doesn't really want to talk about. And the elephant in the room, a lot of times, I know as an occupational therapist, I dealt with this often. Driving was one that came up a lot. So if there's some of those things that are uncomfortable, maybe driving, psychosis, like stuff that maybe you want to talk to the healthcare team about, but you're afraid it might upset your loved one with LBD, what are some things that people can do for that?
Yeah, there's really challenging to try to figure out how to navigate as much as we can, trying to be upfront. Like one of the suggestions I said was trying to have a conversation ahead of the appointment that you as a care partner, are identifying, for example, driving is something you're concerned about. Um, Sharing with your loved one. I think it's important we bring up driving with the doctor. I would feel more comfortable if we checked with the doctor and got their perspective on what's going on. But a lot of these can be really touchy, and that may not be a realistic conversation. So maybe it's that you as a care partner are calling the office ahead of time and asking to speak to the nurse or sending a my chart message, trying again to be as concise as you can, but to say like, my loved one is still driving. We've had a few near misses or unexpected dings on the car. Can we talk about driving at the next visit? That could be one way. I've had families write notes and give notes to the medical assistant as they're being roomed to say like, give this to the doctor. We've had people step out and potentially if they're able to, maybe while their loved one is doing the physical exam, speak more candidly with one of the providers. So there might be some creativity, but it might be, I think one of the maybe best options early on is trying to either send a my chart message or whatever the equivalent is with your healthcare system portal thing, whatever they call it, or you're calling the nurse and speaking with the nurse ahead of the visit.
Absolutely. Good advice. And you guys, Rose popped a link in the chat for one of my favorite resources when I was an OT that really helps kind of guide if you do want to try to have that conversation, like Sarah said, is that first step. It helps kind of guide those conversations about driving, which I know can be really, really tricky. It's by the Hartford Foundation, so definitely check that out. Another question here, and I think this is great. So many times when we're seeing different professionals and different providers, you feel like you're telling your story over and over and over again. So this individual asked if it would be acceptable to share the summary kind of in writing. So when you go to see a new provider or a new doctor, you're not having to rehash the entire thing. You can just kind of give them a written summary, or maybe, like you said, put that summary in like your medical portal.
Yeah, I think that that's a very reasonable option. I would try to keep it as brief, but I know that that's not fair, because how do we sum up everything that's been going on? But trying to kind of keep it at high level things that will, at a glance, that the provider can look at and see, okay, here are the concerns, here's a little bit of our history, or here are the medications we previously tried. If you, knowing the providers who I work with, and they're very lovely, but if you gave them a 5-page kind of written document about your medical history, they're gonna glance at it, but that may not be the most effective way to communicate with them. So just sort of thinking about, how can we make it as digestible for the providers? If you do put it in the medical portal, you may need to be resending that ahead of each visit with a new provider. If you send it once, it will probably get lost in the medical record, buried. And so if you're seeing a new doctor, or want to make sure that the doctor's aware of it, you may need to resend it a few times so that it pops up ahead of each of those visits, which again is annoying. So if you write that document, save it so you can just copy and paste it and pop it back in again.
Good advice. I always find too, doctors like bullet points a lot. So I think the more
Yes.
succinct you can put it in those little nuggets, that's
Yes.
really, really helpful. Good advice here. Thank you. This is a great question. So we have an individual that has a very established and supportive medical therapy team that he's been building over the last couple of years, but he retired in May and now he's in Cobra, and so his insurance is going to end. And so currently, some of his teams at a major hospital system that's not going to be covered by the HMOs that are in the marketplace. And so, what do you think is the best way to communicate that issue and kind of seek recommendations for a care team so that he can kind of move healthcare systems?
Yeah. First of all, I'm sorry that that's the way that our healthcare is set up, because it's terrible that to have to reestablish new care teams, especially when you've gotten some that you feel really comfortable with. I might ask that established care team, looking at kind of who is potentially in your new HMO network, um, to say, either these are the neurologists that are available, and asking your current team, like, are you familiar with any of these providers, or is there anyone you would recommend, like I see from this list or at this institution, because they're available to me. I think that would probably be a good place to start. And then hopefully at some point, once you're eligible for Medicare in whatever way that looks for you, that you'll be able to, your access to care will continue or will expand back. And if you're happy with your new care team, great. If you want to transition back to that old care team with Medicare, you should have more availability again at that point.
Absolutely. Good advice. But I know it's so unfortunate that people have to go through that. It makes it really tough for sure.
It
Um,
does.
So, I think that after getting a second opinion, we have a question here. How do you navigate communication between the two doctors and the two medical systems?
I'm going to interpret this like, how do we transfer care to the new provider? And if I'm misinterpreting this question, I apologize. If you do go get a second opinion and you are happy with the new provider, you can request your medical records from the institution or the doctor's office. There's usually a form, like a release of information and request for medical records to be sent over to the new institution. And you can request that, and it doesn't necessarily have to be completed with the doctor that you were previously seeing. If you want to communicate, this can get a little messy sometimes, so I don't know that this is always the best option. Sometimes people will see both, like, keep the previous provider, because they want to make sure they can still access medication and everything as they're establishing with a new provider. But I wouldn't do that for too long, because then it can get messy about like whose instructions are we following and who's kind of driving or running the show. But you might have a conversation and just say, I think that we are feeling like we want to, explore other options, and we may be back. We're grateful for all that you've helped us with thus far. And, we're kind of in a new place, and we think we need to explore other options. You won't be
Absolutely.
the first, and you certainly won't be the last that might have changed doctors over the course of any provider's career.
Absolutely. All right, one last question here. And this, I think, probably a lot of people are feeling this crunch. I know recently we met with a lot of our COE PIs and our, primary investigators, and a lot of those doctors in their own healthcare systems are struggling with this. And it's the wait time to see a provider. And so this individual is asking, how do we deal with the fact that it can take 3 to 6 months to get an appointment with anyone, including a regular neurologist?
Yeah,
I threw
there's
you a
such,
hard ball. I'm sorry. That's a tough one.
there's such a need. The need outstrips the supply. And so it might be thinking about when you do get an appointment, and we're scheduling, the doctor, let's say, recommends you schedule, come back in 3 months. Maybe you make 2 appointments. You make the 3-month appointment, and then you make a 6-month appointment after that, so that you're kind of trying to you get on their schedule so that you can keep those appointments. Also asking if there's a wait list for cancellations that you can be added to, because things come up and people fall off the schedule. And so can you be slotted into one of those spots that open up? And then some clinics, not all, but some of them have kind of like urgent care spots that may be staffed by an advanced practice provider. And so those are, if there's like something more urgent going on, you tried a new medicine and you're noticing some side effects or symptoms, that you might ask your provider, could I be seen by an advanced practice provider in the time that I'm waiting to be seen by you next? The answers to all of these might be no, but I might ask and explore what possibilities there may be. If you're trying to establish care with a new provider, are there any other providers that you could also try to get an appointment with? And then whoever you can get in to see first, you cancel the other appointment. But you're right, it's such a challenge. I was on a call this morning and we were talking about the wait times for some of our providers, and yeah, I understand both sides of it. I see how busy the providers are, and I also see the need, and I wish that there
Absolutely.
were a different option.
And I just want to say too, for our folks out there who are living rural, it's not just happening to you. I live in the Philadelphia area, and I have an appointment coming up in June to get a new primary that I scheduled in April of last year. So that's how long some of the wait times here have been. And there's some appointments I haven't been able to get yet at all that I'm still trying to get. And so this is an area that I would say we have a lot of healthcare options, but post COVID, I think we're seeing a lot of people have left the healthcare system. There's definitely some issues. So I want you to know you're not alone in this. You can always contact our Lewy line at 1-800-539-9767. They'll try to help you as best they can. But this, I think, is really a system-wide problem we're seeing a lot with healthcare right now. And so, I feel for you. It's not easy for sure. All right, with that, we're going to wrap up. And I just want to thank you again, Sarah, for taking your time to join us today and share your wisdom, and for all of you for sharing your time today with us. And as a reminder, you're going to get an email in about a week with the link for the recording of the presentation. And also, you'll get some resources and links that we talked about today in the webinar for you to have. We invite you to visit the landing page on our website to stay informed about our upcoming webinars and access those recordings. And our next webinar will be in about 1 month on Tuesday, February 18th at 2 o'clock Eastern Time. I'm going to put my OT hat on and present information on how you can cope with visual changes in your daily life with LBD. So finally, please take a moment to complete that survey for us that's going to launch when you leave to help inform our content. And I look forward to seeing you all again in February. Thanks again, Sarah.
Thank you so much.
Take care, everyone. Thank you so much.